To the extent that we live our lives in a manner that is consistent with the truth in our heart, we thrive.
Welcome to the Meyer Clinics podcast, and you just heard a quote from one of your hosts, Dr. Lisa Day. Join our licensed clinical professionals from various backgrounds as they discuss fascinating mental health topics with a wide range of guests. Meyer Clinics is a Christian counseling organization with multiple clinics nationwide dedicated to treating the whole person, emotionally, physically, and spiritually. Welcome to our listening family. We thank you for joining us. Hey everyone, Kristin Walker here, and we are doing a roundtable discussion that's usually with Dr. Paul Meyer, but Paul has abandoned us for the Dallas Cowboys. Okay,
for the Cowboys, exactly.
I mean, really, where are his loyalties? No, he totally deserves to watch the Cowboys. But we have Grant Davis, who has been on before, and I don't want to say where you're in the Dallas location of Meyer Clinics, but give everyone a snippet of what you do there if someone hasn't heard you on our earlier shows.
I'm a psychiatric nurse practitioner. I work with Dr. Meyer out at the Richardson/Dallas office, and I provide kind of medication management or help prescribe medications for people with anxiety and depression and all sorts of mental health, all across the mental health spectrum there. And I work in our day hospital, and I see clients there for medication checks. And and that's what I do, day-to-day basis.
All right, cool. And tonight we're going to talk about obsessive compulsive disorder. I've certainly done shows on this, and I've been a guest on shows that focus just on this. I'd love to have a podcast devoted to this because it's obviously it's a big deal, and many people that have it, suffer tremendously and even attempt or complete suicide from the improper treatment of it or not enough understanding of what they have. So it's important that we talk about this. Runs in my family, and so I have experience with it from being on the receiving end of it, which can be not, I don't want to say not fun. It can be abusive if it's not being monitored. So we've got, some interesting ways to look at it here, but tell our listeners, Grant, why is it that because you said anxiety and OCD are kind of the things that you really like. So what is it with the OCD piece that makes it so interesting and a passion for you?
Yeah, well, I grew up, my dad has OCD, and so it's very genetic, and I have OCD. I didn't know what it was for the longest time growing up. I just knew I had really, really bad anxiety and a lot of worries about things, and had this feeling like I had to do things. I was terrified that something bad would happen to my parents, and while I was at school, and so I would have to pray compulsively. And it was in an attempt. I thought, okay, well, if I pray about this, then nothing bad will happen. And if you ever get caught having fun or not praying, then you feel this guilt and this dread and this sense of panic. And so you just, really, destroys your ability to focus or concentrate on anything. And you kind of, I didn't know what it was. And it would change for me to different things. It wasn't just this, textbook. A lot of people, I think, they think of OCD and they think, oh, somebody's got a fear of germs and they have to wash their hands a lot. And it can absolutely present that way. But for a lot of people, myself included, it kind of can change to different areas of obsession and different areas of compulsion, and can be triggered by different life events and so, just growing up, I would have these little incidents, and sometimes, depending on what the symptom is, you kind of feel like you're going crazy. And I think that's where when you talk about people being very distressed and kind of, making the choice in their life, is they don't know what's going on, and they don't know what they're experiencing is OCD, and they don't know how to put the name on it. And it made such a, for my faith, but in other areas of my life, when I could put the name on it and I knew what that was, it made the distress was still there, but it made it a lot less. And it really helped knowing what it was and why I felt the way that I felt, and why I felt like I had to do what kind of my brain was telling me, no, you need to do this. That compulsion, that need to do something in a certain way, and kind of not feeling like it's a choice, but you have to do it.
Yeah,
and
it does help to know. A lot of people throw around, we have all these labels and we shouldn't have these labels. And I try not to roll my eyes when I hear that, because it's not always a bad thing knowing this is something that you've got. It can be extremely empowering.
Mm-hmm. Yes. And so just kind of growing up with that and seeing how it kind of affected and influenced my life, and has just really made it an area of just a passion for me to really help people that suffer from it, and helping them understand, what it is, specifically when it's not clear cut, when it's not this, somebody comes into the office and, oh yeah, I have OCD, and, I get freaked out about germs and I got to clean everything, but it's these vague symptoms, and they don't have a clue what's going on, and helping them understand what's going on, and kind of getting their life back.
Right. Yeah. Exactly. So you come at this with such a level of compassion because you really understand it.
Absolutely.
Absolutely. Well, you were telling us about something before we went on that you and Melanie need to talk about on the air, because it's something I've never heard of. I'm sure some of our listeners haven't either. Not that if I haven't heard of it, it isn't a big thing, but it's a great conversation, and I don't even remember what the word was you said.
There's a condition. It's an acronym, but it's PANDAS, like a panda bear.
Okay.
Yeah, but it stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. And so essentially what it is it's this very quick onset of what looks like obsessive compulsive disorder, or like a tic disorder, like Tourette's. It happens very suddenly out of nowhere, and when it becomes, what makes it PANDAS is that it is caused by strep, like strep throat, the streptococcal organism, the bacteria, just kind of causes these symptoms that come out of nowhere, and is life-changing for kids and families when this happens, and can be very, very, very hard to treat. And the treatment is different, because if it is associated with the strep, there's a line of antibiotics, and you still kind of treat it some with psychiatric medicines, but a lot of times it can be resistant to psychiatric medicines. And I think, Melanie, you were saying you had some experience with that.
Yes, a lot of people on the show have heard me talk about my little boy, and he is on the autism spectrum. And we have a wonderful pediatrician that actually does autism research and has a lot of thoughts about autism being an autoimmune problem. The body's overrun with inflammation and different things like that. So, and there's tons of different things too that can cause autism-like symptoms, and the PANDAS would definitely be one of them. They can not only mimic, OCD and psychosis and tics, but they can also mimic autism, and even can affect a child's speech sometimes. I mean, I knew a little girl that actually stopped talking altogether because of PANDAS. So we had a wonderful pediatrician that kind of every kid that comes in that has autism, she just treats for PANDAS, because she had done it with a couple of children and got really, really great results from just like a 30-day trial of antibiotics. And And then if there was improvement, then she would continue the antibiotics, and there would be this slow improvement. Now, I'm not talking about curing someone's autism or anything like that, but there were certainly symptoms that were helped by them being on the long-term antibiotic treatment. So it is devastating. I've seen some really strange things happen, and sometimes it can be small things like, your 10-year-old gets strep and then all of a sudden they start wetting the bed again, or they might start getting anxious or something like that. I think it goes to the point that when our children especially start having mental health issues, or even adults, we have to look at all avenues. Sometimes there really is a physical basis to why your anxiety is going on. And so we always have to consider those things. I think I've talked about this on the show too. I was severely anemic and iron deficient, and it was causing a lot of anxiety. And I had no idea that being anemic and having low iron can make your anxiety really bad. And then when you don't have a lot of iron, then your heart kind of works extra to make up for it. So I would have these heart palpitations all the time, which I thought was anxiety. And as soon as I started taking 2 iron pills a day, it really leveled off. So I think it's important that we remember that sometimes these things you do have to, can be a physical underlay other than just, neurotransmitter issues, I guess.
Mine possibly, I don't have it, but family members do, and a lot of abuse in the family, and that's untreated with all these other things going on, was a part of a package that was really difficult to deal with. So I don't want anyone to think that, OCD means abuse. I don't mean that in any way, shape, or form. But let's talk a little bit about, when it does come from trauma, early childhood trauma, especially, what that looks like and the difference between that and where it's more a genetic, where there isn't childhood trauma, it really is a genetic thing.
Yeah. Well, when you think about what happens to the brain in trauma, anybody I think with the statistics, I know Dr. Meyer loves to throw out statistics, but I think they say about 3/4 of everyone will experience something traumatic enough to cause PTSD, post-traumatic stress disorder. And so, that's pretty significant. That doesn't mean you'll develop it, but we'll experience in our lifetime, 3/4 of us will experience something significant enough to cause it. But, whenever we experience something that traumatic, the neurocircuitry in the brain kind of rewires itself, all in an attempt to protect. And the brain says, this was so bad, this was so traumatic, we can never let this happen again. This can never happen to us again. And so you develop these coping mechanisms, these things that, in order to keep yourself safe, and a lot of that can present with obsessive compulsive traits and tendencies, and it's all in an effort done to protect and to keep anything bad from happening. And sometimes that can be, it can make a lot of sense rationally. If somebody is mugged in a parking garage and they develop PTSD, a post-traumatic stress disorder, it would make complete sense that anytime they go into a parking garage, they may have this ritual or this checking that they have to do. Yes. They have to check certain things, make sure where they park, and it has to be done in a certain way. Like that's completely, you would rationalize that out. It makes complete sense. Sometimes we don't have as much rationality to it, and it's ultimately the brain is trying to make sense of it, but it can seem like we do things a certain way, but it's all in an effort to kind of keep the person safe. But it can still cause problems, right? And that may be where you've experienced it before.
Yep, absolutely. Yeah, it presented in a way of, and this is, other people in different generations of our family tree as well, but it presented in a way of really controlling. Nothing is ever good enough. You cannot just relax, because literally your every move is being calculated for what kind of dirt you might leave, what kind of stain you might leave on furniture or carpet. And when I say every move, like, I'm not kidding, like just even sitting down and eating something and being stared at because you might dribble, you know what I mean? And you're an adult, that kind of thing, and running with a napkin and then getting angry and yelling because you don't care about my stuff because you make a mess. That level is what I'm talking about.
You're thinking it from the term of the person, the adult or the family member that has OCD creates an abusive type environment for somebody. Yeah. I was thinking of it like somebody that's experienced trauma can develop OCD symptoms. But yes, that makes complete sense, because the person that has OCD, that's a big thing with any type of anxiety, is we want to control. Because if we can control things that soothes us, that decreases our anxiety. And so it makes complete sense with somebody with untreated OCD that if it's really out of control, that yes, they could try to control everyone in their environment.
Yeah, absolutely. Everyone. Yeah. I mean,
incredibly abusive.
Exactly. And that control, like, you can understand where it comes from, but you're up against a brick wall with that person because they're not being treated.
And you can't rationalize.
Yes, you can.
That's where people with, a lot of times I think with OCD, where you feel kind of crazy, is because it's not rational. Like, it doesn't make sense that I have to tap this door handle 3 times so that a robber doesn't break in. Like, that doesn't, rationally we say that doesn't make any sense. But it's still this deep internal, like, I have to do it. There's this is not a preference.
If that's all I had to deal with was someone tapping a door 3 times, my childhood would have been cake.
But it's so irrational, this, like, okay, crumbs get on the floor, you vacuum it up. Yes. But with somebody with OCD, it's, you don't understand. And it can even be so irrational that it's like, if I eat a sandwich from somebody who or off of a countertop that hasn't been sanitized 8,000 times, I'm going to get HIV.
Yes.
And that's severe. It's like that. We know that's not how you get HIV, but you can't reason with somebody with OCD. They're convinced that something bad or horrible is going to happen, and that's why they have to control it. And as a kid, you see your parent doing that and you don't understand, and that can create so many problems.
You think that you can't do anything right. And you really can't, because nothing can be done right for that person. Mm-hmm. And that's sad that's what's going on, biochemically for them and emotionally and all those things. But when it's taken to that level where raging, screaming, and and every move that you make is just scrutinized, and that's where it turns into, you don't know as a kid on the receiving end. You're just like, oh my God, what if I just sit here and nobody notices me? Am I safe then? Right. I'm not doing anything. I'll try not to breathe. That's what I've heard with kids, that you don't know what the issue is. And then when it continues on into adulthood and you kind of figure out what it is, and then you're like, look, here, this is what this is. Please go see someone. You can live such a wonderful life with this treated, which I want to go into next, like how we treat these things and the different ways they get treated, depending on where it's coming from, genetics more or, trauma more. But when you know that, like, and you're the family member and you're still being treated this way as an adult, you're like, please go. Oh my, I want you to be happy. Like, really, I want to stop being on the receiving end. Absolutely. And I'll go to therapy and deal with my trauma. But please go get help, because this is good for you. And if they won't go, they're just not going to go. And that's kind of, there's nothing you can do about it. It's very sad and frustrating.
Yeah, it is sad. I think Grant and I were also talking about before we started, that so many people think about OCD very stereotypically with, don't step on the cracks, or counting, or washing your hands 10 times. But people need to understand that a lot of OCD symptoms are internal. So sometimes a person can have full-blown OCD, but they really have more obsessive thoughts. They may not have any compulsion that you can outwardly see, but it's this constant loop in their heads all day long of these compulsive, thoughts that make you shameful,
Or it's a mental compulsion. It's maybe not something you outwardly do, but something like mine was there. Mine was a mental, internal compulsion that, was not outwardly seen.
Exactly.
You're absolutely right. You're absolutely right.
Yeah. You were just carrying that around within you, being a ball of anxiety. But you didn't act out with it in ways that would be normally noticed, right?
Yeah.
Yes. It's absolute, this internal distress.
I know, no one likes commercials, but seriously, folks, without the help from these organizations, we could not stay on the air. Please give a shout out to zencharts.com. If you're a mental health or addiction treatment center, you'll want to use their EHR. It's gorgeous, and they're just good people. And also MyGenetics, MyGenetx.com, because knowing your genetic code empowers your mental health treatment. And lastly, CopeNotes.com. We love getting positive messages right to our phones every day from Johnny Crowder. He's the lead singer of Prison, a heavy metal band sharing their music about suicide prevention, addiction recovery, and mental health. See, that was painless. Support them as they support us. Back to the show.
And mine did present, because of that, I had horrible separation anxiety. So, going anywhere without my parents was just this dreaded fear, because I was like, in my brain, I'm thinking, well, they're going to drop me off at school and then they're going to get into a car accident and something bad's going to happen. And so it created this, I don't want to go to school. I don't want to be away, which interferes with socializing and a lot of different things when you're a kid. But a lot of it is this internal stress. And the thing that makes OCD very challenging too is that there's often a lot of fear about medicines and taking them, and that can be where it's where I think sometimes people don't seek treatment. They know that they have anxiety. They know it kind of runs their life, and that's typically how OCD is that it does. For a lot of people, it drives everything. It sounds like your family, Kristin, was that way. It drove everything, but they don't seek help. Sometimes because of a fear of taking medication. But that medication combined with counseling and therapy is absolutely the best way to treat it, in my opinion.
So what kinds of therapy and what kinds of medication?
Yes. So there multiple therapies can help. The one that I did a lot of research on when I was in school was one called exposure and response prevention. And I don't know if I'm sure, I know Melanie's probably familiar with it. I don't know if she ever does any of that, but, cognitive behavioral can help. Sometimes if the thinking is really irrational, I think cognitive behavioral therapy can be less effective because it requires a level of rational thought. And sometimes with OCD, well, most of the time it's not rational. But exposure is, when we had this, so the OCD, the obsessive, whatever the fear is, you work on this graded system of things that are, you start with something that's not very distressing, and you work your way up to something that's very distressing, but you expose the person with OCD to what they fear, and you do not allow them to act on their compulsion or their ritual. What they found with OCD is that when you have this obsessive thought and then your compulsion, whether it's mental or a physical compulsion, the more you do it, the more you reinforce to your brain that so for my scenario, the only reason my parents didn't die was because I prayed X amount of times in school.
Yes.
The more I do it, the more I reinforce that I'm the reason that they lived.
Alive. Yeah.
Yes.
You make them, and it's great. You start with something that's very low, something very distressing. at first, and you don't let them react on the compulsion, and you create a situation called habituation, which is just that you help the brain make the connection that fear thing that you think is going to happen if you don't do X, Y, or Z, it's not really going to happen. And you don't actually have any control over it at all. And it's very distressing initially, but I think research has shown, significant improvement when people are able to do that type of therapy.
Is this something where EMDR would really work too?
Yes, EMDR can absolutely help because you can do it through the EMDR process. You don't actually have to do it necessarily in person, but you can do it through a type of EMDR thing too.
Okay, yeah, because I could see that with, how EMDR works with PTSD. I could see where really, isn't it, and correct me if I'm wrong, but isn't it, you're in fight or flight mode when you're there, and that's why you're just, you're, and the EMDR piece, when I did it myself, was very distracting because the distraction of the rapid eye movement, and also the different pulsing things in the different hands, plus the tapping and, talking through it, it kept me out of that area of the brain while I was talking about this thing I was really, really stressed out about, and that helped.
Mm-hmm. Yeah, it's kind of EMDR is very complex. I think a lot of the ways the way it activates the brain, but yeah, it's a type of being able to expose yourself in your brain to what stresses you out without actually really having to do it in person, in a way, kind of the same way you would process trauma. You're able to think about it in your brain, which would cause a lot of distress, and just process it that way through the EMDR.
Is that what people used to use hypnosis for, or maybe even still do?
I think some people still do use hypnosis for various things. Panic disorder. I think not too long ago I was reading about somebody using hypnosis for eating disorders. But I think hypnosis is still utilized for sure. And I don't know about what the research shows as far as effectiveness with OCD, but I would imagine is absolutely used. I don't know any statistics on how helpful.
I was just piecing it together with how I remember people talking about what hypnosis was used for, because I've been around a long time. So
yeah, I see the connection you're making though, Kristin, because really the therapy that Grant was talking about is similar to the piece of EMDR of desensitization, which is basically desensitizing someone to whatever the trauma is or the fear is. So I can see where that it's very similar to the type of therapy that Grant was talking about. You slowly approach the fear that drives the compulsion. And if you can somehow eventually help push the person through the fear so that they don't need to do the compulsion, then really you've broken the cycle. You've proven to your own brain that what you're doing is not working. And I'm sure that takes a little while, and you would have to start off really slow, but you literally just really have to kind of overcome a hump, because you understand the obsessive compulsive relationship is you're obsessing, you're getting more anxious, and then you do the compulsion, it relieves the anxiety.
Hi, this is Dr. Paul Meyer of the Meyer Clinics. Our Christian counselors across the country have a goal of helping all those who come to us to become what God has called them to be. If you're in a situation where you're not at peace within yourself, or you just feel like there's joy that's missing in your life, we can come alongside to help you obtain peace and joy.
This message is sponsored by the Meyer Clinic Foundation, a nonprofit Christian counseling ministry. The number is 1-888-7-CLINIC, 1-888-7-CLINIC.
So if you can push through the anxiety and push through whatever that is, then you don't have to do the compulsion anymore, which would be really distressing. As Grant, that's some tough therapy. You got to be a good therapist to do that type of stuff. And being able to sit with your clients and being uncomfortable, it's tough stuff for sure.
And I think it's one of those too, I don't know how many people with untreated OCD are, hey, please sign me up for that. That sounds wonderful.
Yeah. I think that would cause some anxiety for sure.
Yeah. I have one client with agoraphobia and panic disorder, and this client has done such amazing work. They are doing exposure therapy, and this client is just killing it with. I have this client on some medication that's helping, but oh my gosh, they just went. We talked about it, and she just went. This client went all in on it, and doing some exposure with driving, and every time I see them, they've done something new. They've taken a new route to the office, which was just this agoraphobic thing. It's been incredible to watch. So I mean, it works, but it does. It takes you have to be
diligent.
Yes.
Yeah, and you gotta really be tough too.
Yeah.
It's hard watching people in fear. Mm-hmm. It's really hard. Yes, it's very hard watching someone's fear and not want to relieve it somehow.
That's right.
But you've got to teach them how to relieve it.
That's right.
Yeah.
Well, and sometimes that fear with OCD, it's just again, we keep talking, it's not rational. And trying, somebody who doesn't understand why you have to do your checking ritual before bedtime, that is just like, clearly the door's locked, like come to bed or whatever. And, 45 minutes later, the person's still checking. Can be really hard for somebody who doesn't get it to understand why this person's having to do what they're having to do, or what they feel like they have to do. I think spouses and loved ones, and it can be really hard to alleviate. But but
what about the medication, with the medication piece? I mean, I know that that's not always, the road to take, but what instances, do you go in that direction, and what kinds of medication?
Yeah, so we typically use the class of medications that's your antidepressant, if you will. So the SSRI medications, which are the serotonin reuptake inhibitors. We've talked about before on the anxiety podcast, but medicines like Zoloft, Prozac, Lexapro, and then also your serotonin norepinephrine drugs, which are also your antidepressants, like Pristiq, can also be used. But those are kind of what they consider first line therapy for OCD. What those medicines that we've talked about them before, but they take the neurochemicals that are already in your brain, they put them in the brain cell where they're supposed to be for the amount of time that they're supposed to be, and kind of really help kind of undo this cycle that OCD is kind of, this chaos that OCD has caused in the brain. And what I tell people, and as my own experience with medication, is it doesn't take away all anxiety. There will still be moments of OCD, but it is a lot less. When you have obsessive thoughts, you're much easier to talk through it. You can start to rationalize. You can say, hey, you can feel the obsession coming, but you're better able to. It's much less distressing, much easier to break out of that cycle, much easier to tell yourself that you don't have to do that compulsion. If you still have to do it, it can significantly minimize the amount of time that you have to do the compulsion. So if you normally have a bedtime routine that could take an hour, you may be able to check the door a couple of times or whatever it takes, check the windows, but you do it a couple of times instead of 10 or 12, and then you go about your day. So, I mean, it can be significant in the amount of time that it gives you back in your life.
Interesting.
Yeah.
I understand this in a way of where as soon as I started taking SSRIs, and this was just around anxiety, but I would have irrational fears like I'm laying in bed and there's a ceiling fan, and I absolutely know that ceiling fan is going to somehow unhinge from the ceiling and land on me and, do whatever. And, as a kid, I was just like, and I would lay there freaking out about this. And once I started taking antidepressants, I would still feel that, but I was able to go, okay, you don't need to think about this. It's not going to happen. Just close your eyes. Like I could I had the tools because I was treated with medicine to be able to talk myself off the ledge.
That's exactly that. You're able to access that rational part of the brain.
Yes, exactly.
And
like,
no, is very good about not being rational, and so you're kind of able to think through it. Like, wait, this doesn't make a lot of sense. Why am I needing to do this?
Right, exactly. And I still catch myself every so often on something from childhood will come up, and I'll be like, okay, that is not, nope. Just don't even give it, don't even allow that sucker to seep down into your brain, because we are not going that way, Kristin.
Yeah, that's a beneficial thing. I mean, I'm thinking about a couple of people that I've known that have had OCD, and one client, and one person, had a teenage daughter that had terrible OCD, and she was so controlled by her compulsions that she would fight. She would hit her family because she was, just wanted to unplug everything in the house before she went to bed because she was afraid the house was going to catch on fire. And they would try to get her to stop, and she would get violent when they would not let her unplug the TV or everything in the house. I mean, it can just be really scary. And then I actually had a friend that had a nephew that was very young. I think he was only like 5 or 6 and was diagnosed eventually with OCD, but this was really frightening. The little boy had obsessions about killing his mom. Yeah. And I mean, this is like the sweetest little boy. And he just literally told her one day, I don't want to kill you, mommy, but I think about it all the time. Can you imagine hearing that as a parent? And eventually, working through with a very good clinician, they came, to the conclusion that he had OCD and had all these other rituals as well. They put him on medication very young. And I mean, can you imagine for a child too, to have those thoughts about a parent and just the shame and guilt that would come along with it. So when it starts in early childhood, like it did for you, Grant, I think it can be really, a journey to work through those things. So it's really cool that you get to treat it now. That's so cool that must be very rewarding.
It's very rewarding. And I think about those situations, how easy would it be to think that little boy had conduct disorder or oppositional defiance?
Yes, exactly. Or that they were sociopath. Yes.
They just have treated OCD, or that little girl that was physical and fighting, that, she's oppositional and she needs all this behavioral syndrome alternative school. And really it's OCD that when you can be managed very well. I've seen kids with OCD, and we start them on some medicine, and it can make all the difference in the world. Yeah, it made all the difference for both of these children. I mean, just night and day for the children. Absolute difference. And when you've got something like that is so, it's just disruptive to the entire family system. Yes, it is. A lot of Kristin's story, your story growing up was how that untreated OCD just disrupts the entire family unit. And then specifically as a parent, if you have kids that have it, how it can just, I think about how out of the way my parents had to go a lot of the times to help soothe my anxiety. The constant reassurance and the checking that I felt like I had to do, and I was in counseling at a young age, but, which helped a lot, but, it can really put a strain on the family unit.
Yeah, my son definitely dealt with it. He absolutely had rituals. He was very anything in relation to feet. And I'm not trying to be funny, listeners. I mean, it may sound funny, but literally, like, anybody's feet got anywhere near him or touched him, he had to immediately shower. It was the best present that he ever got in his whole life, or the second best present. The first was we got a genetic test of his dog. That was like, he was so happy about that. But the second best test present we ever got him was one of those lights that you can put over your sheets and turn the lights off and see how many germs. Oh my goodness, he used that thing all the time and then obsessively cleaned, and that was his thing. And I knew what it was, and we were taking care of it, and he worked through it and did therapy and medication and whatever. But and I'll tell you what cured the caring about germs was a stint in the Marines.
Yeah, he had to get over that real quick.
Yeah, like he said, he came home, Mom, I am cured about my food, because he had
exposure therapy right there.
Exactly.
Thank you. Because the food could not touch other food on the plate. I mean, it was all this stuff. And in the Marines, he's like, look, you're so hungry that you're like, I don't care if that's from the garbage, you're going to eat it.
Right. That's right.
He came home and I was like, who are you? You let me put my feet on you. You ate food that touched and was mixed together, and you laid down and slept on the floor in a bunch of dog hair. Who are you?
So essentially, all patients need to go to the Marines.
Yes, that's what I was going to say. There's the cure. There we go. OCD, just send them, enlist them right there before they leave.
Yeah, a couple years of your life, no big deal.
Yeah, exactly. And potential war situation. Yeah, exactly. Well, this is fantastic. I mean, I like that we can talk about these things and we can have some lightheartedness about it, because we've all experienced it, either ourselves or in different ways through family, and really explain it in a way that is from a touchstone of real life, not just all clinical. It's great to have the clinical information, it's great to have the medicine information, and then also, look, here are some stories of what this looks like. Because as a person in life, if there's an adult that's like you, Grant, and they haven't been treated and they're just suffering in silence, for someone to be aware of what this is and have more compassion, that's what we want for everybody, right? More compassion.
Exactly. Yeah, and just be open-minded about, what might be really going on underneath the surface, or you just never really know. It's definitely worth investigating. Can be life changer for people. Right. Yeah.
Absolutely. Well, thank you so much, Grant, for coming on, and for sitting in for our beloved Paul Meyer, who is probably yelling at the television right now.
I'm sure the
Absolutely.
Cowboys are losing.
I hope they win, just for him.
I told Kristin when I read the email, I was like, I don't even watch football, but I hate the Cowboys. Like, I just don't like them. I never have liked the Cowboys. I don't know why.
I only want them to win for Paul. That's all.
Yeah, you must really have to be from Texas to be a Deer fan. It's so funny.
So if anyone
so much for having me on the show too.
Absolutely.
I really appreciate it.
Absolutely.
Yeah.
And anyone that wants to know more about what Grant does and what Meyer Clinics does, please go to their website. We don't mention it enough. Go to meierclinics.com. There's 14 of them across the United States. And I talk to someone from Meyer Clinics at least once or twice a week. And I love these people. I mean, my gosh, the care. You want every mental health professional to have this much compassion and, and empathy and care. That's what you want when you're going through these kind of struggles. So I really, I love it that you work there, Grant, because you seem like such a good fit. And Paul just, you know how he gets on the show. It's almost embarrassing how much he raves about everybody.
He is very good at that. He definitely is.
Yes, he is.
Love it at Meyer Clinic, and that is definitely what we all strive to do, is just help people. Yeah, absolutely.
All right. Well, listener, Melanie, thank you for being on as well.
Absolutely.
And,
thank you.
and listeners, thanks for tuning in to another edition of Roundtable with Grant Davis on Mental Health News Radio.
We hope you enjoyed this podcast. Tune in next time for another engaging discussion on relevant mental health topics. If you have any questions about Meyer Clinics, please visit our website at meyerclinics.com. That's MEIER clinics.com, or call us at 888-7-CLINIC. Don't forget to leave us a review on iTunes, Stitcher, or any of your favorite podcast apps. And please note that we are a member of and produced by Mental Health News Radio Network, MHNRnetwork.com.